Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, we're going to have our popular health care update and then an innovative way to approach county and regional problems in the second half of the program, something you don't want to miss. All of that following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we have our monthly health care update, and we call in our experts. Today we have Stuart Shapiro, who's president of the Pennsylvania Health Care Association, one of our experts we call in to get advice and to find out what's going on in the important field of health care. Boy, I'll tell you, Stuart, first of all, welcome as always.
Hi, Terry. Nice to see you.
Look, let me tell you something. It's the #1 domestic issue in the country right now. It polls as the #1 issue, again, domestic issue in the presidential election. And here we have what I think is, and we chatted briefly about this maybe last year, but I want to bring it up again. We got somewhere in the neighborhood of 75 million of us who will track through the big age, 65, collecting Social Security, collecting Medicare, or in the Medicare program, not arguably several $1 trillion. We have a presidential election going on. Are you hearing anything that makes you feel good about this?
Well, the presidential candidates are talking about health care in general.
In general, right.
But very unfortunately, they're avoiding the whole issue of long-term care. And it's interesting. The presidential debate was in Philadelphia.
Right.
And on January 1st, 1 second after midnight in 1946, the first baby boomer was born in Philadelphia. She's leading a wave of 80 million baby boomers. 70% of these folks are going to need long-term care. Many of them believe Social Security, Medicare, and Medicaid will pay for it. It won't. Social Security can't by law. Medicare only pays a trivial amount. And the state governments are all unable to increase their Medicaid budgets.
Yeah.
Leading cause of catastrophic family health care expenses today is long-term care. Yet none, zero of the presidential candidates
that's a great
are
point.
proposing anything or even discussing it.
And let me tell you why I think why. You either agree or don't agree. First of all, there seem to be two solutions, and it's an and/or. One, cut benefits, and/or, you know where I'm heading, somebody has to pay for it. Do you think that's the problem? They don't want to go down that road?
Well, you're talking Social Security. I'm talking beyond Social Security, beyond Medicare, and beyond Medicaid. We've got to find a financing mechanism to deal with this. Federal government today spends almost half of its budget on Medicare, Medicaid, and Social Security. And we have to find a solution that is not a new entitlement program or just doesn't tinker with Medicare and Medicaid or Social Security. It's interesting, though, on the presidential candidates. We did a survey of all of their websites, and we looked to see whether they talked about Social Security, Medicare, or long-term care. 300 times they mentioned, the Democrats mentioned Medicare, Medicaid, and Social Security, mentioned long-term care a couple of times, but no one proposed a solution.
In other words, they don't go to the implication of what happens when people live longer and there's a catastrophe and they need to put someone in a long-term facility. They don't go from A to B. Is that what you're saying?
No, they do not. And 70% of us are going to need some form of long-term care coverage. And there are solutions, and we ought to begin to talk about them. And they shouldn't be a new entitlement program. They could be a national commission that looks for bipartisan solutions.
Right.
But we can't delay this discussion.
Well, I agree. I mean, I think this is a huge problem that is, as I pointed out, that I've seen a figure of $3 trillion. Now, you're the expert on this. But at that point, we're talking about so much money that we need a dramatic, if not a radical, solution to the problem, or else how are we going to continue? I mean, you know what happens to the cost of providing health care once you reach about 70. The costs go up. They almost quadruple, whether it's drugs, whether it's in a long-term care facility or whatever. And somebody's going to have to pay for this ultimately, right?
Somebody's going to have to pay, and we need to start to plan at an individual level and at a governmental level of how we're going to approach this problem.
Yeah.
And there are solutions. People should be beginning to think about buying long-term care insurance.
Yep. I couldn't agree more with you. And go ahead. Stay on that point.
And fortunately, the governor led an effort to get long-term care insurance expanded in Pennsylvania. This needs to be implemented, and hopefully they'll be doing that. But there are also other solutions. We ought to be able to have special savings accounts planning for our long-term care insurance. We ought to be able to look at solutions of tax deductibility for long-term care insurance.
So we're going to go to a break, and I want to get back. I want to stay on this subject. But what you're basically saying is this is not one size fits all. There needs to be a variety of a menu of ways to approach the problem. Yes, no?
Yes.
All right. We come back. We'll continue our discussion with Dr. Stuart Shapiro following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with Dr. Stuart Shapiro, one of the experts we call in from time to share his knowledge, in this case about health care. More particularly, we're talking about these big entitlement programs that are going to have to absorb 70. I said 75. Dr. Shapiro says 80. We're not going to quibble over 5 million. It's a huge number. I want to go back. You went very quickly over these. To some of the options that you think ought to be on the table as we talk about how we're going to fund these huge health care programs. Go ahead.
Right. Let me just summarize again. 70% of the 75 or 80 million baby boomers are going to need some form of long-term care. It's the leading cause of catastrophic family crises over dollars.
Right.
Solutions. Number one, we could have a presidential commission similar to Social Security in 1983 that could address all these issues and propose something
and
to
hopefully
the Congress.
Be bipartisan.
Oh, it absolutely has to be bipartisan,
it.
or you're going to get nowhere.
Yeah, I agree.
And there's several issues that ought to be on the table for this commission. Number one, people ought to be able to have above-the-line deductions for long-term care insurance. Two, people ought to be able to have a voluntary program that they can invest pre-tax dollars in for long-term care. Three, they ought to be able to have certain tax credits for taking care of loved ones that are income limited. They ought to be able to have, right now, our health care is deductible in cafeteria plans with our employers. We ought to put long-term care insurance in there. All of these are going to require state or federal changes. But the solution cannot be a new entitlement program.
Yeah.
Today, Medicare, Medicaid, Medicare, Social Security is $1 trillion part of a $2 trillion federal budget. We can't add a new entitlement.
And
so we have to find creative bipartisan solutions.
And politically, it's probably going to be difficult to do that because, you know, the big question is, but this menu approach that you articulated, I think, has a lot. But here's the point. We're going to have to invest both government and individual resources into this problem like we did Social Security, you know, over a 30 or 40-year period in order to stabilize the fiscal situation so that when folks who are in their 40s and 50s now need this long-term care, they're going to be able to, A, pay for it, plus we got to have the facilities in order to accommodate them.
Absolutely. And we ought to figure out solutions. I mean, we could also have programs where people's life insurance could be switched to a payout for long-term care. Can't be, by and large, across this country.
Yeah, before we let you go, give us a quick update on nursing homes and Medicaid reimbursement. It's something that we talked about before. How is that situation?
It's terrible in this state. Right now, nursing homes take care of a lot of people on Medicaid. And virtually every day they lose money. Their costs exceed what they're being paid by the state government.
Right.
And this is leading to an escalating crisis around this issue. Unfortunately, Medicare is able to support some of that issue by providing some extra dollars. But the state is...
But that's only for a limited time period.
It's only...
It's 90, a certain number of days.
Yeah, but we're still at a point today where nursing homes, which 65% of their patients are covered by Medicaid, the reimbursement does not meet the cost of care, and it is a crisis, and we're hopeful that the legislature and the governor will continue to try to address this issue.
All right, great update. If you care about local government innovation, you want to stay with us for the next part of the program. We'll be back after we pay some bills. See you soon.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Welcome back to the program. Well, you know, a lot of the times we're talking about problems and local problems, state problems, and, you know, we try occasionally to get into the subject of governmental intervention. What is good? What changes can we bring about that make government work? We've got an exciting program today dealing with that subject. It's called YorkCounts. I'm going to let my special guest talk about that in a moment. Joining me is Eric Menzer. He's the co-chair of Metro York Project and vice president of Wagman Construction. Did I get that right?
Wagman, yeah.
Wagman. I should know that. And State Rep Bev Mackereth, who's from the 196th State House District in York County. It's the last time I want to mention that number. You're a York County House member. How's
yes,
that?
I am.
Does that work for you?
Yes.
All right, I don't know. Look, first of all, let's talk about YorkCounts. What is it, Eric? Let me go to you first.
Yeah. YorkCounts as an organization and the Metro York Project is a citizen-led initiative. In the case of Metro York, civic leaders, business leaders, nonprofit leaders with elected officials working together to try to come up with some solutions to what we view as sort of the root cause, core problems that negatively affect economic prosperity and quality of life in the Metro York area.
All right, what are the core problems?
What are the core problems?
And I'm sure there are several.
Many.
I understand. Go ahead.
A lot of it is, well, I would say first off, what most people would tell you, it's taxes.
Right.
It's how expensive things are, and that the way that we continue to do business may not be the best way to continue to do it. Some of the other problems, of course, we have education, healthcare issues, transportation issues, and a lot of that leads us to where we need to take a better look at our communities to make good decisions on how do we do a better job.
All right,
the quality of life issues.
All right, you got an organization consisting of a wide variety of folks. You got a set of core issues. Eric, let me ask you the $64,000 question. Right. Well, so does every other community.
Well,
so what are you doing that's different that we should care about?
The truth of the matter is it's not just every community in Pennsylvania, it's every community in America.
Well,
what we do in Pennsylvania, however...
It's called Pennsylvania Newsmakers.
Right.
Go ahead.
Well, what we do in Pennsylvania is that we structure our communities in a certain way in terms of municipal government and school districts that, in our opinion, both exacerbate those problems and make them more difficult to attack and to improve. Now, we made a decision very early on. This project is not about consolidating local government, and it's not about getting rid of or consolidating school districts. There are a lot of virtues.
The structure stays the same.
Structure stays the same, and frankly, I'm actually kind of tired of the argument that says we have to consolidate. I worked for local government. I like knowing my school board members. I like knowing my city council members. That's not the issue. The issue is how can we work with that structure, work smarter, work better, work in different ways to overcome that structure. To work more cooperatively among municipalities on how we tax ourselves.
Right.
To work more cooperatively and aggressively among municipalities in how we do land use planning, transportation investment.
So does this mean, Bev, that you've got to, I mean, this is a pretty big coordinating job. I don't know how many municipalities are in York County.
Right.
40, 50
60
probably.
some.
Oh,
Yeah.
60 some, okay. Are you trying to pool all of them together? I noticed there's the York Metro. Is it just, what is the sense of that?
The YorkCounts group, really looks at all of York County.
Okay.
It's about all of York County. However, the Metro York project is really centered around the metro area around the city of York. And that's really a starting point. You can't do it all at one time.
That's a great
We've got
point.
to
That's a
begin
great
somewhere.
point.
But I think the important thing, you asked what's different. You know, why is this important?
Yeah.
It's different because this is about the people coming together around issues that impact all of us, bringing forth the collective minds and wisdom of people that are working within the system.
So this is government, business, labor, consumer groups. Go ahead.
All of
leaders, nonprofits,
Yeah.
coming together and saying these are the issues we have to address, and addressing them at their level, as opposed to the top-down model. This is a bottom-up model.
Let's be specific. You know, I want to get to some long-term implications.
Sure.
Let's be specific. Take police.
Right.
You know,
Right.
all the problem, you know, you have one jurisdiction, you go 5 miles, you got another jurisdiction,
Right.
you go another 3 miles, you got another jurisdiction. Is that a good or a bad example of what you're talking about?
That's a great example, because one of the initiatives that we're recommending that has the most traction is to regionalize police on the entire Metro York level. And in fact, 3 or 4 or 5 of our departments, the chiefs themselves have actually been proponents of this. And it's not just about, or even primarily about, saving a few bucks. It's about doing it more effectively. You know, we have a stretch of Route 30 that goes through 5 municipalities in 2 miles. So somebody robs a store at one end, drives 2 miles.
And
We've all heard
in,
these stories, right? Well, the police of the chiefs of police and many of the elected officials in these areas, city or suburb, are saying, you know, this is nuts. We have outgrown this system. You know, in a sense, we need to grow up, and we need to attack this problem regionally. In the Metro York area, as an example, it's the case in most of Pennsylvania. The core of the problem is in the old third-class city of York, with the fewest resources, the most stressed tax base,
and with some of the biggest problems.
As a metro, and those problems are spreading out. So as a metro area, why are we sitting here and expecting the lowest income, poorest municipality in our metro area to fight the core of the problem? Doesn't it make sense to do it together in a different way?
We're going to take a break. When we come back, Bev, I want to ask you, is there a role for state government in this? We'll come back to this subject matter following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. We're talking about an exciting new set of recommendations that are coming out of York, Metro York and YorkCounts. The name of these organizations we won't dwell on too much. We're dealing actually with some very important concepts, and I think that's what's important. Well, look, let me ask you this, Bev. The state legislature could be helpful here in terms of providing not so much money, I think, but creating an environment where governments can be more flexible and work with each other. Exactly. Am I right or am I wrong about that?
You're absolutely right. I think the role of government in all this is really, state government is really going to be to remove barriers. If this group comes together and says, or the school district, whatever it may be, and says, we believe that we can solve some of our problems by doing whatever that may be, the recommendations, it's our responsibility then to try to remove the barriers that prevent them from being successful. Mm-hmm. Will that also mean possibly some financial assistance? Of course it may. Right. But that's what grants are all about. And so I think that state government plays a critical role here. But to get it done, it's state government, and then say to everybody in Pennsylvania, you've got to do it the way we think is right, won't work and would never work.
That's right.
But for a group like this to come to us and say, this is what we would like, this is what we think is going to make a difference in the quality of life of our people, then it's important for us to get on board and assist them.
You know, one of the potentially limiting factors in all of this, an intrusion into it, could be partisanship. Mm-hmm. And you know, how you get Democrats and Republicans, independents and others to kind of put away their partisanship and say, you know, this, how can this work? What's going on over there with, with partisanship?
We have tried from the very beginning to have local elected officials very involved in this. Township supervisors, school board members, our state delegation. And I'll tell you what we have found is that, I'm not going to suggest there's no partisanship and there's no parochialism, but the fact of the matter is quality of life, economic prosperity, there is no Republican or Democrat way to go about it. And I think our elected officials that have been involved in this effort truly believe that. I actually think in York that with the rapid growth we've had, with the concerns people have about taxes and rapid development, the loss of farmland, they really have said it's far more important to attack the problem.
Let me interrupt you a minute and ask either one of you to answer this. Do you think that once the problems get so overwhelming, now York's a pretty prosperous place, you've got a lot of growth, a lot of activity, but the problems of growth can be so overwhelming that is that forcing people to say, we can't do this alone?
Yeah, absolutely. Absolutely.
Absolutely it is.
Yeah, they've seen that. I mean, you know, a road that stretches through 5 municipalities, and every stage out there's a new housing development, and all that traffic's coming into my municipality. And I think we see that very dramatically in a lot of the fast-growing areas of York County where people are saying enough is enough. You know, I may not have been a huge fan of zoning and land use planning, but boy, look at the negative consequences of the alternative.
Yeah, we have about a minute.
Well, I also think you need to realize and remember that the biggest problem affecting York County right now is the property tax issue.
Right.
And
which is an issue in many parts of the state as well.
Exactly. And to address that issue, we're going to have to address some of the root causes of what's going on with our system of education, and that's another issue that this group is looking at.
The final question, is there a broader implication? I mean, is this kind of a model that could be employed by other counties? I mean, how long do you think you need to get down the road until you can make some assessments about...
They're calling all the time now, looking at what we're doing. I think the real model is you can't sit around and wait for the state legislature to do this stuff for you. Get your you got to get the community organized, build the political consensus, build the civic business citizen consensus, and it's amazing how all of a sudden things become possible when you got a group of folks across party lines at the local level that are demanding that it happen and hoping that it happens.
All right, well, we're out of time. This was a great update. When you get down the road here a little bit, let's have you back and we can chat about what works and what doesn't work. I think as a model, this would be pretty important. Stay with us here. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well. Stay well.